Hi, my name's Jonathan Glover and I work at the Marriage Recovery Center. One of the questions that I get asked a lot is, are we ready for couples counseling? Or how would we know if we're ready for couples counseling? Now, I'm a firm believer in doing a thorough assessment or evaluation before starting any type of behavioral health service. And doing couples counseling is a little bit unique because I'm really looking at your relationship as my client. And of course, the relationship is comprised of two individuals and their dynamics in that relationship. Now, when I'm doing an assessment, one of the services that we offer at Marriage Recovery Center is called a marriage evaluation or a relationship evaluation. And when I'm doing that evaluation, I'm really looking at the individuals themselves and what they're bringing to the dynamics, and also what do those dynamics look like within the context of communication and the relationship. One of the very first things that I'm looking for and screening for really is safety. Safety is a really important thing to look for first and foremost. If there's any type of abuse present, sexual abuse, physical abuse, domestic violence, self-harm, suicidal behaviors, any of those types of behaviors, if they are present, then I'm likely to immediately give a referral for a different type of service before doing any type of couples work. Another thing that I'm going to be looking for when I'm screening and doing this evaluation process with the relationship is untreated addiction. Now, addiction could take the form of a chemical addiction, like to nicotine or marijuana or alcohol, but addiction can also take the form of what's called process addictions, and those are behavioral addictions, so things like sex addiction or gambling. And these addictions have a profound effect. They have the potential to have a profound effect on the relationship, on your spouse, on your own health, and it's important to account for these dynamics and to treat those addictions if they are present before working with the couple. Another thing that I am going to be looking for if I'm doing a marriage evaluation or when I'm meeting with a couple for the first time is any untreated mental health conditions or physical conditions that might be interfering with the relationship or providing some type of contributing to some type of adverse effects or dynamics. So examples of this would be untreated schizophrenia or other type of psychotic disorders, other types of untreated mental health conditions that might be treated with medications. Certainly if an individual has a diagnosis and has been prescribed certain medications and they're not taking the medications as prescribed, that would be important to look at. Now, after assessing for or screening for these types of really concerning individual conditions and dynamics, then I'm looking more into what is each of the individuals bringing to the dynamics, to the relationship, to the communication. And you often hear that marriage is 50-50, and I cringe sometimes when I hear people say that, especially when they're talking about what type of harm each other is bringing to the relationship. Because ideally, yes, marriage should be 50-50, not meaning that we give half of ourselves to the relationship, but we're each, both people, giving 100% of ourselves. Each of us are giving 100% of ourselves. Now, when I hear people talking about the problems that are present in the relationship or the harm that one or the other person is bringing to the relationship, and I hear marriage is 50-50, a lot of times what I hear is a lack of responsibility, not taking responsibility for their own harm and pointing fingers, doing a lot of blaming for the dynamics that are present. It's important to note that there are some relationships and some dynamics where there is harm that is caused exclusively from and by one person, the perpetrator or the offender, and there is a victim in this case. And by saying something like, marriage is 50-50, and these dynamics must be 50-50, we run the risk of doing what's called victim blaming. Basically, the belief that because there's some sort of harmful dynamic, that the victim must have done something to antagonize this or warrant this or invite this type of harm, and that's not always the case. In a lot of cases, there is a perpetrator or an offender of harm, and there is a victim. So one of the things that I'm looking for is these types of dynamics, and I'm listening for these. As I'm speaking with the couple or individuals, I'm listening for if these types of dynamics and power differentials are present. As I said, it's important to note that in a relationship, it's both individuals, and ideally both individuals should be healthy and complete themselves before looking at the dynamics that are present within the context of the relationship. I'm looking first for what are the shared goals and the shared values. If both people in the relationship have the goal of the relationship, that's an important starting point. Sometimes I meet with a couple where one person is very, very invested in the relationship and the other person really doesn't know if they want to continue the relationship. Doing couples counseling in that case is going to be pretty difficult because those two people are not on the same page. So a shared goal, a shared vision needs to be established before even knowing what it is that we're working on. Also, both individuals need to be able to speak from their core self. They need to be speaking without defensiveness, without any of the defensive strategies that come up when we are feeling uncomfortable or threatened or accused. The ability to be able to speak from your core self is very important during the process of couples counseling. Also, each individual needs to be able to speak with compassion and provide space, a safe space for vulnerability so that their partner can share and receive information with safety and security present. Both individuals need to be able to identify harm. They need to be able to speak to the harm that they have experienced within the context of the relationship, but also be able to identify the harm that they have caused the other person or the harm to the relationship itself. In doing this, they need to be able to, as Dr. Hawkins speaks about, stay on their side of the street rather than pointing fingers over to the other side, to their spouse, and doing a lot of the blaming. Also, individuals throughout couples counseling need to be able to be solution focused, not problem focused. And this is difficult because, of course, we're talking about problematic dynamics that are present within the relationship. But the couple needs to be able to be continuing to move forward in a solution-focused type of way. There are several different times that sometimes I talk about where harm can occur. One is when things are going fine and all of a sudden something happens that doesn't sit right with you, that makes you feel uncomfortable or unsafe. That's one time that harm can occur. Another time is when you go to your spouse to talk about this, to say, hey, there was something that just happened that didn't sit right with me, that didn't feel good. It made me feel unsafe. And in that time, if your partner's response is harmful in itself, that is problematic. Now, the third time that harm can occur is when is sort of during the what I call return and repair work. And this can look like two different things. One is when you are moving towards each other to do the return and the repair work for past harm. Harm can occur then, but oftentimes the harm that occurs during this phase looks more like a lack of returning to do the repair work. It's a lack of that work to begin with. Now, I'm mentioning this now because in relationships, harm is going to occur. We're going to say things to our spouses that are unkind, that are thoughtless, and we're going to offend. We're not perfect. That's going to happen. But if we can create environments in which we can speak to each other about that, that is the important part of providing that safety and security. And a lot of times that's what we're working on in couples counseling, and focusing on building that and creating that safe space for each other. A big part of couples counseling is in that second and third phase, in sharing our needs and our wants, and what direction we want to move, and in doing the repair work from past harm. Also, it is important to be able to accept feedback. The reason why couples come in for counseling is because they're looking for feedback from a counselor or a therapist or a coach. And if an individual or if the couple is unable to receive this feedback, either from the counselor or from each other, that's going to get in the way of being productive and moving towards shared goals. It's sort of a lot to account for, but that is what I'm looking for readiness for couples counseling. Now, if a significant portion of those things are not present, then I'm likely to provide instead referrals for individual work first, so that one person or both partners can build those skills and then be more productive within the context of the couples counseling. If you enjoyed this video, go ahead and give us a thumbs up or a like or subscribe. I will provide links below to our other resources. If you have questions or want any clarification about any of the topics that I've discussed today, please contact our client care team at marriagerecoverycenter.com. They would be more than happy to help out with any questions or concerns that you have.